Nursing Diagnosis Part 1. Disease conditions including in this video are HIV, coronary artery syndrome or myocardial infarction, Alzheimer's disease, anemia, intracranial aneurysm and angina pectoris. First one is HIV. HIV is also called as human immunodeficiency virus, and AIDS full form is acquired immunodeficiency syndrome. HIV causes AIDS and interferes with the body's ability to fight infections. The virus can be transmitted through contact with infected blood, semen, or vaginal fluids. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweat, fatigue and recurrent infections. No cure exists for AIDS, but strict adherence to antiretroviral regimen can dramatically slow the disease progress as well as prevent secondary infections and complications. Nursing diagnoses are ineffective airway clearance related to pneumocystitis pneumonia, increased bronchial secretions, and decreased ability to cough related to weakness and fatigue. Pain related to impaired perianal skin integrity secondary to diarrhea, Kaposi sarcoma, and peripheral neuropathy. Imbalanced nutrition less than body requirements related to decreased oral intake. Social isolation related to stigma of the disease, withdrawal of support systems, isolation procedures, and fear of infecting others. Impaired skin integrity related to cutaneous manifestations of HIV infection, excoriation, and diarrhea. Diarrhea related to enteric pathogens or HIV infections. Risk for infection related to immunodeficiency. Activity intolerance related to weakness, fatigue, malnutrition, impaired fluid and electrolyte balance, and hypoxia associated with pulmonary infections. Disturbed thought process related to shortened attention span, impaired memory, confusion, and disorientation associated with HIV encephalopathy. Anticipatory grieving related to changes in lifestyle and roles and unfavorable prognosis. Deficient knowledge related to HIV infection, means of preventing HIV infection, and self-care. Second disease condition is coronary artery syndrome or myocardial infarction. Any condition brought on by a sudden reduction or blockage of blood flow to the heart is called coronary artery syndrome. Acute coronary syndrome is most often caused by plaque rupture or clot formation in the heart's arteries. Symptoms may include heart attack like chest pressure by resting or doing light activity, or sudden heart stoppage. This condition is treatable if diagnosed quickly. Treatment may include medication such as blood thinners, clot busters, or beta blockers. Surgery may be required. Nursing diagnoses are ineffective cardiac tissue perfusion related to reduced coronary blood flow, risk for imbalanced fluid volume, death anxiety, risk for ineffective peripheral tissue perfusion related to decreased cardiac output from left ventricular dysfunction, deficient knowledge about post-acute coronary syndrome self-care. Third disease condition is Alzheimer's disease, a progressive disease that destroys memory and other important mental functions is called Alzheimer's disease. Brain cell connections and the cells themselves degenerate and die, eventually destroying memory and other important mental functions. Memory loss and confusion are the main symptoms. No cure exists, but medication and management strategies may temporarily improve symptoms. Nursing diagnoses are impaired thought process related to decline in cognitive function, risk for injury related to decline in cognitive function, anxiety related to confused thought process, Imbalanced nutrition less than body requirements related to cognitive decline. Activity intolerance related to imbalance in activity or rest pattern. Deficient self-care, bathing or hygiene. Feeding, toileting related to cognitive decline. Impaired social interaction related to cognitive decline. Deficient knowledge of family or caregiver related to care for patient as cognitive function declines. Ineffective family processes related to decline in patient's cognitive function. Fourth disease condition is anemia, a condition in which the blood doesn't have enough healthy red blood cells. Anemia results from the lack of red blood cells or dysfunctional red blood cells in the body. This leads to reduced oxygen flow to the body's organs. Symptoms may include fatigue, skin pallor, shortness of breath, lightheadedness, dizziness, or a fast heartbeat. Treatment depends on the underlying diagnosis. Iron supplements can be used for iron deficiency. Vitamin B supplements may be used for low vitamin levels. Blood transfusion can be used for blood loss. Medication to induce blood formation may be used if the body's blood production is reduced. Nursing diagnoses are fatigue related to decreased hemoglobin and diminished oxygen carrying capacity of the blood, altered nutrition less than body requirements related to inadequate intake of essential nutrients, altered tissue perfusion related to inadequate hemoglobin and hematocrit non-compliance with prescribed therapy. Fifth disease condition is intracranial aneurysm, a weakness in a blood vessel in the brain that balloons and fills with blood. Most intracranial aneurysm occur between the underside of the brain and the base of the skull. The aneurysm can leak or rupture, causing life-threatening bleeding. An unruptured aneurysm usually causes no symptoms. A key symptom of a ruptured aneurysm is a sudden, severe headache. Treatments for an unruptured aneurysm include medication to control blood pressure and procedures to prevent the future rupture. Nursing diagnoses are ineffective tissue perfusion related to bleeding or vasospasm, disturbed sensory perception due to the restriction of aneurysm precautions, anxiety due to illness or restrictions of aneurysm precautions. Sixth disease condition is angina pectoris, a type of chest pain caused by reduced blood flow to the heart. Angina is a symptom of coronary artery disease. Angina feels like squeezing, pressure, heaviness, tightness, or pain in the chest. It can be sudden or over time. Depending on severity, it can be treated by lifestyle changes, medication, angioplasty, or surgery. Nursing diagnoses are acute pain related to decreased myocardial blood flow as evidenced by reporting of pain, anxiety related to situational crisis as evidenced by expressed concern regarding changes in life events, deficient knowledge related to underlying disease and methods for avoiding complications, non-compliance, ineffective management of therapeutic regimen related to failure to accept necessary lifestyle changes. Thank you for watching.